Today we're talking about acute coronary syndrome. Now, if you've never heard of this, you've never even seen these words before, that's fine. What I like to do when I encounter something that I don't know or I don't understand is I like to break it down into smaller pieces. And I feel like this is just a good life tip when you don't understand something. If you can figure out what the individual terms mean or the smaller pieces of it mean, usually you can make sense of what's going on. So let's do that now. Now, when the word acute means something that's new or recent, this is the opposite of something that's chronic or something that's been going on for a very long time. Coronary refers to the vessels of the heart, and specifically, we're talking about the vessels that supply the heart muscle with blood. So it's the heart's own blood supply, if you will. And finally, a syndrome is just a group of symptoms. So even without knowing anything about what acute coronary syndrome is, you can deduce that it must be a group of symptoms that have come about recently that have something to do with the vessels of the heart. Now, what does this look like? We said that the coronary arteries were the ones that were supplying the heart muscle with blood. So here they are. You can see one kind of wrapping around the outside of the heart. And what happens is that these arteries get clogged with plaques, and usually these are cholesterol plaques. Now, you can imagine that if an artery is blocked, then blood can't get through. And so if you're starving the heart of blood, you're starving it of oxygen. And so sometimes you might experience things like a heart attack, unstable angina, really anything that causes this disruption in the flow of blood, the flow of oxygen to the heart can be a cause of acute coronary syndrome. Okay, so let's talk about what this would look like. Now, it's important to kind of understand what a person experiencing acute coronary syndrome looks like, because if you encounter them on the street, in a restaurant, something like that, you want to be able to recognize what's going on. Now, first and foremost, you might see someone clutching their chest, and this is because one of the number one symptoms is chest tightness. Additionally, people report that they feel pain radiating down their left arm and up into their left jaw as well. People often say that they feel a heaviness in their hands, and this is both hands, both the left and the right hands, and really the hands and the arms. And then finally, if you think about just what happens when you're in distress, any type of distress, you might have sweating. The person may be short of breath, and they may have dizziness as well. Now, it's important to note that in certain groups of people, namely women and diabetics, some of these symptoms may be different, and we'll get into that another time. Okay, now what can you do to prevent acute coronary syndrome? First and foremost, quit smoking. Smoking is just bad news when it comes to things like high blood pressure, diabetes, heart disease. It just makes everything worse. So the thing that you can do to prevent acute coronary syndrome the most is to quit smoking. Second of all is diet and exercise. Now, diet doesn't mean that you need to go on a diet, but you can imagine that if the arteries are getting clogged with cholesterol, you really need to be mindful of fatty and cholesterol-filled foods. And of course, you need to exercise, because exercise will increase the blood flow to the heart, kind of prevent the buildup of some of these plaques. And finally, you need to take medications as prescribed. Now, this one may be a little more vague, but maintaining overall health for things, again, like high blood pressure, diabetes, kind of ongoing illnesses, will will be keeping you in better shape overall. But also, if you've had heart problems before and your doctor's given you something like aspirin or a beta blocker, something to improve your heart function, you have to take your medications as prescribed to prevent acute coronary syndrome from happening.